Good afternoon, everyone. Welcome to our third webinar introducing you to the new and updated standards. Thank you so much for spending your lunchtime with us. My name is Mary Catherine, and I am a physiotherapist and the manager of the practice advice team here at the college. I joined the college as a practice advisor in 2020. Prior to joining, I spent my career as a clinician in a variety of settings, including acute care and rehab hospitals, and I spent the last 15 years as a clinician and clinic director of a multidisciplinary private practice.
Hi, everybody. My name is Evgenia, and I'm a policy analyst here at the college. So, like Mary Catherine, we call her MC. I have also been here since 2020, and I've been working closely alongside the practice advice team to review our standards of practice. And we are also joined today by a member of our communications team, Allison, who will be collecting your questions today and managing the question and answer Q&A function, as well as dropping any relevant links in the chat. So today we have four new standards of practice that have taken effect on February 1st, and these are the collaborative care, conflict of interest, dual practice, and infection control standards. So as with our other standards webinar series, if you've had the opportunity to join us for those, you will be able to send your questions through the Q&A throughout the presentation. And we will be taking some time to answer your questions twice. So once at kind of the halfway point after the first two standards, and then once more at the end. So there will be some time to send in any questions you might have. Okay, now before we dive in, we're first going to be launching a really quick poll. So wondering, have you had the chance to comment on these standards when they went out for consultation? And this would have been in June of 2024 until about late August. So just go ahead and throw in your response there. Okay, perfect. Thank you so much for responding, everybody. I will move on to the next little bit. Okay, so for anyone who might have missed the context behind this work, I like to start these presentations by just giving a really brief overview of why we're reviewing our existing standards and coming up with new ones right now. So what does this project really look like? Now, this is the third group, and there's 5 in total, of standards to be reviewed in a bigger project that we have here at the college to align the national standards called the Model Standards of Practice with our practice trends and our context here in Ontario. So the national model standards have been developed collaboratively with the physiotherapy regulators in all Canadian provinces, and it aims to really outline where physiotherapy practice is similar across all of the provinces. And now this is where the term model comes in, because then each province gets the chance to model or customize the national sort of boilerplate framework according to what works best for their context. So that's kind of what we're doing here right now. And with that, we can officially get into the third batch of standards. And we're going to start with the collaborative care standard, which is a replacement of the college's previous collaborative care standards. So kind of the same name there. Okay, so the beginning of all of the standards talks about the purpose and the outcome, as you might know. And the purpose of the collaborative care standard is for physiotherapists to work collaboratively with their patients and other members of the health team, effective and patient-centered concurrent care. And the outcome here is that patients expect that their physiotherapist will collaborate effectively with others, such as other health professionals, in support of coordinated and integrated care. Now, the next part of the standards are the performance expectations, and some of the key ones in this standard are highlighted on your screen. The expectations here first say that physiotherapists should ask their patients if they're receiving concurrent treatment for a same or similar condition, and this is in order to figure out where collaborative approaches might be needed. Now, the standard suggests that collaboration here means that this is everybody involved in the patient's care. So like the patient themselves, their caregivers, of course, other providers, and members of the health team. Physiotherapists must make sure that concurrent care is the right approach for their patient, meaning the approaches are compatible, they're clinically indicated, they benefit patients, and are a good use of resources in general. And if another provider would better serve a patient's interests, a physiotherapist should consult with them or, if needed, refer to them as well. Now, the standard also says that physios should try to anticipate the potential risks that could arise in concurrent care situations and take reasonable steps to address them in a collaborative way. So, these risks are actually the reverse of the reasons why one might want to pursue concurrent care in the first place. So, the risks might look like conflicting approaches, inefficient use of resources, and the risks outweighing the benefits to patients. And finally, a performance expectation that I'll talk about says that if a physiotherapist chooses to discontinue or decline the physiotherapy portion of concurrent treatment, they must discuss their reasoning for doing so with their patient and then also document that conversation. Okay, so those are kind of the highlights, and now I'll hand it over to MC to take us through what this might look like in terms of clinical practice.
Sure. Thanks, Evgenia. So really what we kind of try to summarize it as with some of the new standards of what's new, what do I need to know? And then answering some of the questions that were submitted to us both in the consultation phase of the standards, but also since they've been in practice. So really there's not a lot that's terribly new in this standard. We did have a previous standard, as Evgenia said, with the same name. This standard does provide more specific guidance regarding the expectations of the collaborative care situation and a reminder that collaboration occurs with patients, with their families, with other healthcare providers, and with other physiotherapists. There was a question around what does compatible approach mean exactly? So there are definitions at the end of each standard that help to clear up some of the terminology that are used in the standards. So in this case, the compatible approaches means methods and strategies that complement each other, that they work without conflict, and that they support the patient's treatment goals rather than hindering them. So one example could be a physiotherapist who is providing manual therapy and therapeutic exercise for a patient with low back pain, but a second physiotherapist is providing acupuncture for pain relief. So in that instance, those could be compatible approaches. Another question that came up frequently was around whether or not two physiotherapists can provide care to the same patient at the same time. And that's a common misconception that two physios can't provide care to a patient at the same time. And I think that the standard makes it clear that yes, this definitely can occur. The focus in these situations really is on communication with the other provider, both with the patient, with the family. Providers need to make sure that they identify, communicate, document, and manage those risks of concurrent treatment. All of the physiotherapists involved are sharing the responsibility for patient safety. So if you find yourself in a collaborative care situation or you're contemplating one, some of the questions you'll want to ask yourself include things like, is my care compatible with the other healthcare provider or therapist? Is it clinically indicated? Is my care in the patient's best interest? Is my care an appropriate use of human and financial resources? Have I identified risks? For example, if there are any unneeded duplications of services, is it considering the energy level of the patient? Could there be a cause of excessive fatigue because of two people working with the same person? Are there any approaches that could be contradictory to each other? Identifying what the communication challenges might be that interfere with safe and quality care. And then once you identify those risks, how will you manage those risks? So for example, ensuring you've had discussions about anything that feels like it could be a potential conflict between healthcare providers and making sure that you're bringing patients along in your conversations and in your clinical reasoning. And as Evgenia said, if you are considering a discharge within a collaborative care situation, ensuring that you can meet the requirements from the duty of care standard around discharge. Probably one of the most common questions that we as practice advisors use the collaborative care standard to help explain or help provide guidance on is the question around when a patient has asked for an external provider to come in and provide care while they're still in a hospital or rehab facility, and how can the physiotherapists in that circumstance provide safe and effective care. So both the internal and the external physiotherapists will need to ensure that they have the patient's consent to communicate with each other. They will need to consider how they'll share information, since the external physiotherapist wouldn't have access to the hospital records. And they would need to consider if it is an appropriate time for that external physiotherapist to come in. We have created a table to help you review what to consider and what to ask when you're in a collaborative care situation, specifically in that circumstance when you're working as either with an external PT or as an external provider. And Allison will post that document in the chat for you now, in the Q&A section for you now. And you can also find it as a resource in the Collaborative Care Standard Guidance document. Evgenia?
All right, thank you so much. Amazing. Now we'll move on to the Conflict of Interest Standard, which has also replaced the college's previous standard with that same name. So the purpose and outcome here is really just to ensure that physiotherapists recognize, avoid, or otherwise mitigate any real potential or perceived conflicts of interest. And this is to prioritize the best interests of their patients so that patients can expect that their physio will deliver care that is in their best interests only, and not kind of clouded by anything else. Now, turning to the performance expectations of this standard, they first highlight that physiotherapists must identify situations, know how to, and identify situations of any real, potential, or perceived conflicts of interest. Again, the standard reinforces that the patient's needs and interests must always come first, and as such, no agreement should be entered into that might jeopardize that, or any agreement that could compromise a physiotherapist's professional judgment. So examples of this are highlighted in the performance expectations, and this might include paying for or providing benefits for referrals, or receiving a benefit for making referrals on the reverse side, referring patients to your own services without providing full disclosure and alternative options, which is commonly referred to as a self-referral. And this could look like something like referring hospital patients to a private clinic, so referring to yourself, and contracts that might incentivize specific product sales or a specified number of treatments. So again, financial incentives for doing those things. And in general, according to the standard, in situations where a physio cannot avoid a conflict of interest, they must take steps to mitigate it. So an example of this is by providing full disclosure to their patients, making them aware of alternatives, and documenting how the conflict was managed. So the standard makes specific mention of selling products as an example of how mitigation could take place, stating that the physiotherapist must inform the patient that they can purchase the product elsewhere other than the clinical setting, and that their choice of where to purchase the product won't affect the physiotherapy services that they receive. So disclosure, alternative options, and consent are really key concepts in the standard when it comes to mitigating a conflict of interest. Okay, so I will now hand it over to MC to talk about the practice and patient-facing setting.
Thanks, Evgenia. So while not exactly new, this new version of the conflict of interest standard does clearly state that physiotherapists must put the needs of the patients first. One of the simplest ways of thinking about this is that if you are doing something in your own best interest and not in the patient's best interest, you are likely in a conflict of interest. As Evgenia stated, examples of conflicts of interest are stated and listed in the standard, such as contracts that incentivize the sale of products or physiotherapy visits. And this was the standard that may have generated the most questions, so we'll get right to them. Your first question is regarding something called using affiliate links. So something when you are maybe posting on social media or on your website, and that it links a patient to, or a member of the public to purchase a product. And so what you'll need to consider is that you have to be transparent with regards to any financial or other benefits that you receive for having that type of link. You want to make sure that you're providing alternatives when there is a patient therapeutic relationship, and be clear with patients that their use or non-use of the link would not negatively or positively affect patient care. Another question is around endorsing a product. So physiotherapists can be asked to perhaps endorse a product. And if you are asked to do so, consider that whenever you as a physio use your professional title in support of something, you must be sure that it is done appropriately, professionally, and within your scope of practice. Your opinion should be free of bias or conflict of interest, and you must disclose if you're being paid to endorse a product. So payment might be in specific financials, but it could also be with regards to referrals to your clinic or other benefits to your clinic or to yourself. And then finally, there must be some science and evidence to support the use of the product in physiotherapy prior to you endorsing a product. Another question that comes in is because lots and lots of physio clinics sell products, and when does a selling or profiting off of a product cross the line and become a kickback? So consider that the things like the markup on a product has to be reasonable. There has to be transparency in place that this product is often available from other places and the prices may vary. And you want to make sure as a physiotherapist that there are no incentives in place for you to sell a specific number or have a benefit for a specific volume of something being sold that would come back and be in your own best interest. So it must be clinically indicated and have a really strong clinical reasoning as to why you're recommending something to a patient. And then finally, another common question is whether or not a physiotherapist can refer a patient. So let's say you work in a hospital or rehab setting, but you also have a part-time position where you provide home care services to people after they're discharged. And can you refer a patient to a home care service that belongs to you if you've seen them in the hospital? So the answer is yes, as long as you are transparent about the fact that that service does belong to you, and you provide your patient with alternative choices as to they can also contact these other places where home care services can be received. You want to make sure that they are clear that they are free to choose without having a negative effect on the care that they are receiving in hospital as well. Going on from conflicts of interest questions, we've had other scenarios, and I thought maybe I could involve all of the participants in the webinar today to help me tell me what you think about some of these scenarios. So, is this physiotherapist? Could they be in a conflict of interest? And if they are, how could it be modified? So the first situation is a physiotherapist who is recommending a knee brace for a patient, but the physiotherapist works in a clinic where they actually receive a bonus of $500 from the clinic owner if they manage to sell 5 of these knee braces per month. So does anyone, you can use the Q&A if you want to just let us know, does anyone think that yes, this would be a conflict of interest, or no, this seems like it would be appropriate? Yeah. So lots of people saying, yes, absolutely, that's a conflict. So it's not that we can't recommend a knee brace for patients. Of course, we can recommend that. However, we want to make sure that we have assessed the patient, we ensure that it is clinically indicated, and it's okay if you need to make sure that there's a reason, or there has to be a reason to recommend it. There can be a profit made off of a knee brace as long as it's commensurate with why that was charged. There's an explanation for that, and there really shouldn't be any incentive for selling a certain number, because that could put that physiotherapist in a conflict of interest and make decisions in their own best interest. Absolutely, you guys nailed it. All right, the second example is a physiotherapist who is also working as a life coach. And so they have kind of two hats that they wear. And they have a patient that they've seen in physiotherapy, and they recognize that this person could really benefit from having a life coach involved. And so what they are recommending is that they could also see them as a life coach after every physiotherapy session for a half an hour each time. So the physiotherapist is a physio, but also works as a life coach. And in their physio role, they're recommending the patient also sign up for life coaching sessions with them that could be added to the end of each session. Is this a conflict of interest or not? What do you guys think? Okay, so this is a little trickier one. Some people are saying no, not a conflict. Some people are saying yes, definitely a conflict. Others are already giving us examples of how it could be a conflict, but you have to be transparent. So yeah, absolutely. And this one's kind of, I like this example because we're going to touch base on the dual practice standard, which is another one we're going to look at. But when someone has two roles and you recognize that a patient could benefit also from services of your second that you provide as in your second role, you do have to make sure that you are being transparent about that they could also seek someone for coaching in another sense, and really consider if you're the best person to be providing that service. Just because you can provide the service, consider whether or not it's in the patient's best interest for you to provide it, or should they be seen by another pair of eyes? Would they benefit from being assessed by somebody else, and really having two separate people working in those roles, one as a physiotherapist and one as a life coach? So just an interesting one to consider when we do wear more than one hat in our practice. And it's not just a matter of providing them with alternatives, which is definitely a big important part of it, but also consider whether you're the best person for providing it, whether or not you could maintain your therapeutic boundaries in the physiotherapist patient therapeutic relationship in that situation, or whether it would be better to have a separate person involved for that second service. Thank you so much for all your participation. I'm loving your answers. And then finally, our third scenario is that a physician and her family members are treated for free in a physiotherapist-owned clinic because the physician refers many patients to the clinic. Is this a conflict of interest or not? So it's a physio-owned clinic, and a physician who refers frequently can come as well as their family members to be treated for free. All right, everybody's saying yes, definitely conflict of interest. This can very much be seen as a benefit for referral. So they are providing a benefit. So as physiotherapists, we can't provide a benefit for referral or receive a benefit for referral. And this, I think, would definitely be seen as a benefit for referral. So yeah, absolutely agree with all of you. I think this is a conflict of interest as well. All right, thank you so much for your responses. Over to you, Evgenia.
All right, great. Thank you, everybody. We are now, I guess, going to be taking a bit of a pause here for any questions you might have up until this point. So with the first two standards that we talked about, collaborative care, conflict of interest, and just a reminder that we will have another space for questions towards the end. So yeah, if you have any right now to drop in the chat, feel free. But if not, that is okay too, and we'll have some more space for questions towards the end if anything at all comes to mind. Okay, hearing nothing, we'll just chug right along. And just breaking up the two sets of standards here with a bit of a poll again. So right now, this one is which part of the new standards or the standards in general do you read the most? So do you read the standard statement and refer to that, the expected outcome, the performance expectations, so that little checklist kind of in the middle of the standard, the definitions that help to interpret some of the terms, or do you mostly look at additional resources and guidance, such as FAQ, supplementary guidance documents, things like that? Just a bit of an informational poll for us to help improve some of the way we deliver information.
I know for me, I tend to jump right to performance expectations and then I go to definitions because I want to see how something is defined. And then sometimes I tend to skip right over that standard statement and I have to kind of go back to it. But I'm curious, I'd love when we can get the results on this one too before we move on.
Yes,
So we can see
definitely.
what everybody's thinking. Maybe we should have included a choice of, I didn't know there were different options.
For next
Oh yeah,
time.
look at so yeah, same. You guys are the same as performance expectations. You should kind of jump right to that one. And then the standard statement. Okay, great. And then just a message on that accompanying resource and guide. So these are, if you remember the way that the old standards, the way that standards were previously set up, there was kind of an FAQ link beside it, and then it took you to a new page. Now on these updated standards, you scroll to the bottom and there'll be a resource link to the bottom, and that will bring you to the FAQs and any documents that are relevant to the standard itself. And some of these are still in development. So I know Evgenia and I have worked together on a lot of these resources. And so if you see a resource, for example, that is not linked yet, or if you see that it seems to have changed since the last time you looked, it's because these are very much being updated on a regular basis to make sure that we've got all of the relevant resources for you.
All right, perfect. So with that, let's now shed some more light on the PT/life coach scenario that we had just talked about by moving on to the dual practice standard. Now, this is technically a new standard for right now, although I will say that the college did previously have a dual health practices standard, and that was from about 2005 to 2011. So if you're around that time, perhaps you would have recognized it. If not, for all intents and purposes, it is new. So, purpose and outcome. The purpose of the standard here is to ensure physiotherapists clearly identify, and to their patients in particular, instances where they're proposing or providing services that are not physiotherapy. So, life coaching being an amazing example of that. And here, the patients are made aware of when a service doesn't constitute physiotherapy to really support transparency and patient-centered care, informed decision-making, everything like that. Turning to the performance expectations, the first key one here is that physiotherapists must not represent a non-physiotherapy service as physiotherapy. So what this means is that if it's outside of the physiotherapy scope of practice, must not call it as physiotherapy, and that includes not being able to use your protective title. So you must not use the protected physiotherapist title when providing, like during the course of providing non-physiotherapy services, because that would be representing it as physiotherapy. Next, if a physio does offer non-physio services as part of their practice, these services need to be established as separate entities to make sure that patients are not confused about the different types of services. So the standard includes some ways that this can be achieved, and that is through separate invoices, separate patient records, or separate entries within the patient record to clearly identify what is and is not physiotherapy. And finally, distinct appointment times so that the two services are not kind of lumped together into a combined appointment. Next, physiotherapists must prioritize delivering physiotherapy services first if that's what the patient came in for. And this is before offering or providing any non-physiotherapy alternatives, with the only exception being that the physiotherapy services wouldn't be in the patient's best interest. So essentially, the standard says if the patient seeks out physiotherapy services and that's what they want, that's what the physio should provide and prioritize providing first before jumping to those other options. All right, and then the last kind of key performance expectation point here is that physios must clearly communicate and disclose to patients about what is and is not a physiotherapy service and obtaining informed consent throughout. And really, this is kind of the hallmark of the standard, is making sure patients understand getting their consent, and making sure that separation part is really there and that it comes through for patients. Okay, so with that, what's new, MC?
Okay, so while this whole standard is new, really, we didn't have this in the last go of standards. And I think it's a really helpful one. I think a lot of physiotherapists are going to find some excellent guidance in this. It clearly advises us as physios to not use our protected title when providing services that are not physiotherapy care. We have to, as you said, make sure that we obtain informed consent from patients for non-physiotherapy services by discussing what those implications of having the non-physio services from their physio could be. This could have financial implications, for example, that the service might not be reimbursed by their insurer, or that there could be potential boundary risks to the therapeutic relationship by that physiotherapist engaging in a non-physiotherapy service. So you did ask for some examples of scenarios of what a dual practice could look like. So for example, let's look at if a physiotherapist is also a clinical psychologist. So a physio is also another member of a regulated health profession. So it seems easy enough to kind of separate those two points of care. As Evgenia had earlier mentioned, you'll need to make sure you have a separate appointment for each of those services. So you wouldn't be able to book one appointment and be a physio for 20 minutes and then a psychologist for the last 40 minutes. You're going to have very separate and distinct appointments. You will want to ensure that your invoices are distinct and that you meet the requirements of each college that you belong to. You would need to separate your clinical records, your charts for each profession that you are practicing, and you would also have to need to have distinct times for each of those services. So with the example of a physio who's also a psychologist, it might seem easy enough to keep those two practices distinct. But another common scenario is when physiotherapists have dual titles and the scopes of practices of these titles might overlap. So for example, you're a therapist who has also trained as an osteopathic manual practitioner, for example. So while you don't have guidance from college with osteopathic manual practitioners, as they're not regulated, you do need to meet the requirements of the dual practice standard from the College of Physiotherapists. So again, you would need to be very clear with patients which role or title you're using in the appointment. Your financial and clinical records must accurately reflect that title and role you're practicing in, and you should have separate and distinct times for each service. And as Evgenia said, if the patient has come in asking for physiotherapy care to receive physio care, you prioritize providing that type of care to them. Now, sometimes a physiotherapist has another title that's outside of being a healthcare provider, such as a realtor or a mortgage broker. And in that case, you should also ensure that they can meet the requirements of this standard. And here there's some overlap with some of the considerations from the conflict of interest standard. So for example, the physiotherapist has to ensure that they've provided the patient with options and that it's clear to the patient that they're not obligated to see the physiotherapist for that extra service. The physio must be very careful to keep the services absolutely separate and distinct from physiotherapy care. So for example, if you were also a mortgage broker, you would not want to be discussing banking or interest rates related to the mortgage in question during a physiotherapy session. And then lastly, there were questions around what non-physiotherapy services might look like. So here again, we need to consider that many physiotherapists also provide services that are kind of adjacent to physio practice, but might not meet the definitions of physiotherapy care. So examples could include things like teaching general exercise classes or yoga classes, where participants have not been individually assessed and there hasn't been a clinical, an indication for clinical need established. So while physiotherapists may be very qualified to deliver these types of classes, they often don't meet the standards of what is physiotherapy care. So if you're not sure if a program meets those definitions of physiotherapy care, you can always reach out to us in practice advice. We are happy to talk it through with you to consider whether or not that other service you're providing would meet the definition of physiotherapy care. All right, Evgenia, back to you.
Great. All right, so we have now arrived at the last of the 4 standards in batch 3, and this is the infection control standard. And this one has replaced the college's previous infection control and equipment maintenance standard. And if you're wondering, the equipment maintenance portion actually moved right on over to the risk management standard, which was a part of Group 1. So this one focuses on the infection control aspect of things. And here, the purpose of the standard is to ensure that physios follow infection prevention and control protocols to ensure a safe physiotherapy environment. And patients should expect that these measures are in compliance with best practices, as well as any relevant laws, regulations, and expert guidance in infection control, specifically as it relates to the particular practice setting physios are working in. And in the performance expectations, we see first that physios must acquire some knowledge and aptitude around infection control best practices that are relevant to the setting in which they work. So, be it a hospital setting, private practice, wherever this may be, there are some specificities for infection control depending on the setting. And this also includes being familiar with workplace processes and policies as well. The expectations also say that physiotherapists must then consistently apply routine practices in their clinical setting. And routine practices are the ones that could be outlined in guidance prepared by the Provincial Infectious Diseases Advisory Committee, so PIDAC. And so these are just general practices in the maintenance of a safe physiotherapy or healthcare environment. And the standard include some examples of what this might look like. So this could be conducting a point of care risk assessment prior to each patient interaction, using personal protective equipment or PPE, and practicing effective hand and respiratory hygiene. So of course, this is not an exhaustive list, but this is just some examples that are provided within the performance expectations here. And with these things in mind, physios must make sure that all spaces and equipment are properly cleaned and disinfected before patients use them, and that any disposable devices and materials are properly disposed of afterwards. If reusing critical or semi-critical equipment, physiotherapists must sterilize them carefully and then document the sterilization and reuse of this type of equipment. And finally, in the performance expectations, a key component here is really for physios to always be aware of the external rules that could be related to keeping good, proper infection control in their practice. And the few examples are listed in the standard as well. I've already mentioned the employment-specific rules, but this also includes information from equipment manufacturers for any equipment that you might use, any relevant legislation. So as an example, the Ontario's Occupational Health and Safety Act, as well as standards and policies from Public Health Ontario. So all of these things could be relied on to ensure you're keeping up with good practice, though of course, again, not an extensive list, and these are just some examples that the standard highlights here. Okay, so with that and for the final time, let's now talk about some practical elements to the standard.
Thanks, Evgenia. So as Evgenia just earlier mentioned, this standard is very similar to the previous infection control standard, with the exception of the equipment maintenance information is in the risk management and safety standard, which came into effect last August. The standard clearly lists the Public Health Ontario's PIDAC, or Provincial Infectious Diseases Advisory Committee, recommendations as the gold standard guidance to follow. They have a guidance document called Routine Practices and Additional Precautions in All Healthcare Settings, and it was just updated this month, June of 2025. And Allison's going to link that for you to be able to refer to. It has the specifics for all healthcare settings, including how to do a point of care risk assessment, what to consider with regards to hand hygiene, use of personal protective equipment, PPE, and how to handle droplet contact precautions. So always refer, they are the experts on this. We will always refer you to their guidance. The standard also has specific guidance around that all patient spaces are cleaned and maintained according to their recommendations. as well as to how the use of equipment and disposal of equipment is done according to that guidance from PIDAC. So some of the questions that you've had related to this standard include specific questions around, precautions that should be taken when working with vulnerable populations, such as patients who are in long-term care. And we're always going to refer you to default to the guidance either from the IPAC group of your specific organization or from what's being recommended by the experts in public health. Just as in clinical care, the college doesn't provide you with specific clinical guidance, clinical pathways or anything like that, or infection pathways, but will provide you with the resources so that you can review your infection control protocols. We've also, in last month's perspectives, we developed a resource for physiotherapists who are maybe providing care in patients' homes or they're working in a solo practice, and some questions to ask themselves when they're developing an infection control policy. And that will also be linked for you here, and it can be found in the resource section of the infection control standard. Questions around how to create an infection control policy can be found in that guidance that I just referred to. And again, you'll find resources for that within the guidance from Public Health Ontario. And then the last question was around, can physiotherapists still request that a patient wear a mask in a treatment setting? And the answer is for sure. If your point of care risk assessment identifies a patient with signs of a respiratory virus, or there's a situation where you're finding that a mask needs to be worn, you have clinical reasoning to determine that, a mask can be requested and should be provided. If the patient is refusing, you can always recommend alternatives to inpatient or in-person care without a mask, such as virtual care, or delaying the appointment until the virus symptoms are resolved. So that's still the recommendations that were developed during the pandemic can still be used at this point if you're identifying a virus, an active virus. Okay, those are your questions around infection control. We've got one last poll for you, I think.
Yeah, perfect. So this one is just about your reaction to this group of new standards. So how do you feel about the new standards? Are you confused and need to spend some time reviewing them? Are you feeling pretty neutral because there isn't a lot that's truly new for you and it doesn't really add too much to your plate? Are you feeling frustrated because these are a little bit too much to work into in terms of new expectations or anything like that? Or are you leaving us today with an optimistic feeling, seeing how these can better serve the public interest and strengthen the physiotherapy profession? So that one's going to go for a little bit, and it would be great if we can show the results for that one as well.
And once you completed the poll, if you've got some questions for us, please enter them into the Q&A section.
Okay, seeing lots of optimism and or neutrality here, a little bit of confusion. I'm optimistic that you're optimistic personally, and as MC had mentioned earlier, we are working on developing some supplementary guidance for any additional questions, FAQs, little sticky points that might come in with respect to the new standards to hopefully alleviate some of those confused feelings, which of course are totally understandable when it comes to new standards. Okay, so we now have our last bit of room for questions today. I don't know if I'm presenting and can see the Q&A at the same time, so maybe somebody can let me know if any of those come in.
Sure. There looks like there's a question. I did touch on this. So there's a question whether if a physio is both working as a physiotherapist, but also is certified as a yoga instructor, can the physiotherapist deliver both services because he is qualified for both? Or is it only that there is transparency in the services and that he is billing separately? So a physiotherapist can definitely also work as a yoga instructor. However, it should be recognized that delivering a yoga class isn't going to necessarily be considered as physiotherapy care. And so you could let participants of the class know that that you are a registered member of the college, that you do work as a physiotherapist in a different facility, but in the moment of teaching that yoga class, you are not working as a physiotherapist, so that patients or participants in the class don't confuse being in the class as receiving physiotherapy care. So just be really clear with what your title is, what role you're playing in that instance, and that it should be clear to the participants that they are not receiving physiotherapy care in that moment. Great question.
Okay, if there is nothing else to note, I think we have 15 minutes of time to give back to everybody here. And I want to just close off by thanking everybody for being here today, for all your great engagement throughout the session, and as well as all the feedback that you have been raising throughout the entire standards review process. Yeah, either here or during the consultations phase. It's all very much appreciated, and we love hearing from you all. MC, anything to add?
I just wanted to maybe we could let participants know that there are further opportunities coming if they haven't participated in the consultation phase. What's still coming for them to participate in as a consultation?
So we still have just one standard remaining, kind of hanging in the balance, and that one should be up for consultation shortly. There is a board meeting coming up. We're going to be talking about it. It's the supervision standards. So some of you might have already participated in the boundaries and sexual abuse standards that are coming forward. So thank you for making your voices heard on those ones. And supervision is coming up next. As for any of the other questions related to the standards, maybe you missed the consultation phase, totally okay. That is what practice advice is here for. And the contact information there is right up on your screen. So if you're interested in sharing any other feedback, thoughts, questions about any of the standards that we have discussed today or any of the other ones, please feel free to do so through email, phone, however you like.
Yes, Samira Merchant and I are the two most likely candidates who will respond to your calls or emails on practice advice. We're always happy to hear from you.
All right. Thank you so much, everybody, and we hope you have a great rest of your day. Take care now.
Thank you. Bye-bye.